Dear students, in the last module we studied about schizophrenia. After studying this module, you shall be able to know what does the term bipolar disorder actually mean, what are the signs and symptoms of bipolar disorder, what are the causes of this disorder, what are the different types of bipolar disorder, and about the effects and diagnosis of bipolar disorder. Bipolar disorder, which is also known as bipolar affective disorder, manic depressive disorder, or affective psychosis, is a mental illness characterized by periods of elevated mood followed by the periods of depression. Symptoms of bipolar disorder are severe. They are different from the normal ups and downs that everyone goes through from time to time. The elevated mood is significant and is known as mania or hypomania, depending on the severity. During mania, an individual feels or acts abnormally happy, energetic, or irritable. They often make poorly thought out decisions with little regard to the consequences. The need for sleep is also reduced. On the other hand, during periods of depression, there may be crying, poor eye contact with others, and the negative outlook towards life. Other mental health issues such as anxiety disorder and drug misuse are commonly associated. Bipolar disorder is characterized by transition between depression and mania. Now we shall go with the history of bipolar disorder. Swings of mood between good and bad have been observed as part of the human experience since throughout the history. The words melancholia, an old word for depression, and mania has Greek origin. The word melancholia is derived from melis, meaning black, and chole, meaning bile or gall. On the other hand, Greek word ania means to produce great mental anguish, and menos meaning relaxed or loose. The term manic depressive reaction appeared in the first American Psychiatric Association Diagnostic Manual in 1952, influenced by the legacy of Adolph Meyer, who had introduced the paradigm illness as a reaction of biogenetic factors to psychological and social influences. However, the classification of bipolar disorder was first proposed by German psychiatrist Karl Leonhardt in 1957. He also introduced the terms bipolar for those with mania and unipolar for those with depressive episodes only. Next is signs and symptoms of bipolar disorder. People with bipolar disorder experience usually intense emotional states that occur in distinct periods called mood episodes. Each mood episode represents a drastic change from a person's usual mood and behavior. Mania is the defining feature of bipolar disorder, which is an overly joyful or overexcited state. A depressive episode commonly follows an episode of mania, which is an extremely sad or hopeless state. Sometimes a mood episode includes symptoms of both mania and depression. This is a mixed state. People with bipolar disorder also may be explosive and irritable during a mood episode. Manic episodes. The onset of a manic or depressive episode is often initiated by sleep disturbances. Mania is a distinct period of at least 1 week of elevated or irritable mood, which can take the form of euphoria. People with mania may also experience a decreased need for sleep, speak excessively in addition to speaking rapidly, and may have impaired judgment. To meet the definition for a manic episode, these behaviors must impair the individual's ability to socialize or work. If untreated, a manic episode usually lasts for 3 to 6 months. People with bipolar disorder may also abuse alcohol or substances due to combination of adventure seeking and poor judgment. They often have relationship problems and perform poorly at work. At more extreme levels, a person in a manic state can experience psychosis, a state in which thinking is affected along with mood. Approximately 50% of those with bipolar disorder experience delusions or hallucinations. Next is hypomanic episodes. Bipolar disorder can be present even when mood swings are less extreme. Such a state is known as hypomania. Hypomania is a milder form of mania, defined as at least 4 days of the same criteria as mania, but does not cause a significant decrease in the individual's ability to socialize or to work and lacks psychotic features like delusions or hallucinations. Overall functioning may actually increase during episodes of hypomania. Hypomanic people generally have increased energy and increased activity levels. Most commonly, symptoms continue for weeks to a few months. Next is depressive episodes. Signs and symptoms of the depressive phase of bipolar disorder include persistent feeling of sadness, anger, isolation, anxiety, and hopelessness, which is coupled with sleep disturbance, loss of appetite, fatigue, apathy, depersonalization, irritability, chronic pain with or without a known cause, lack of motivation, and suicidal tendency. In severe cases, the individual may become psychotic, a state in which thinking is affected along with the mood. These symptoms include delusions and rarely hallucinations. A major depressive episode persists for at least 2 weeks but may continue for over 6 months if left untreated. Next is mixed state episodes. In reference to bipolar disorder, a mixed state is a condition during which symptoms of both mania and depression occur at the same time. Individuals may have manic symptoms like grandiose thoughts, while at the same time may experience depressive symptoms such as excessive guilt or feeling suicidal. Next is causes of bipolar disorder. Scientists are studying the possible causes of bipolar disorder. Most scientists agree that there is no single cause. Rather, many factors likely act together to produce the illness or increase the risk. The cause is not clearly understood, but both genetic and environmental factors play a role. Typically, many genes are involved. Environmental factors include long-term stress and a history of childhood abuse. The cause of bipolar disorder is likely to vary between individuals. Genetic influences are believed to account for 60 to 80% of the risk of developing the disorder, indicating a strong hereditary component. First, we shall discuss about genetic cause. Genetic studies have suggested that many chromosomal regions and genes are related to bipolar disorder susceptibility. The risk of bipolar disorder is nearly 10 times higher in first-degree relatives of those affected with bipolar disorder in comparison to the general population. Similarly, the risk of major depressive disorder is 3 times higher in relatives of those with bipolar disorder when compared to the general population. Next is physiological cause. In addition to abnormal brain chemistry, abnormalities in brain structure may also play a role in bipolar disorder. Functional MRI findings suggest this abnormality. Other brain components which have been proposed to play a role are the mitochondria and the sodium ATPase pump. Alterations of these components are believed to cause cyclic periods of depression and mania. According to the kindling hypothesis, when people who are genetically predisposed toward bipolar disorder experience stressful events, the stress threshold at which mood changes occur becomes progressively lower until the episodes eventually start and reoccur spontaneously. Next is environmental cause. Various researchers suggest that environmental factors play a significant role in the development of bipolar disorder. There are fairly consistent evidences from relevant studies that recent life events and interpersonal relationships contribute significantly to the likelihood of onsets and recurrence of bipolar mood episodes. There have been repeated findings that 30 to 50% of adults diagnosed with bipolar disorder report traumatic or abusive experiences in childhood, which is associated on average with earlier onset and a higher rate of suicide attempts. Next is neurological cause. No often very common, but a bipolar disorder may also occur as a result of neurological condition or injury. Such conditions and injuries may include stroke, traumatic brain injury, etc. Next is neuroendocrinological cause. Dopamine, a neurotransmitter responsible for mood cycling, has been shown to have increased transmission during the manic phase. The dopamine hypothesis states that the increase in dopamine results in secondary homeostatic downregulation of key systems and receptors. This results in decreased dopamine transmission characteristic of the depressive phase. The depressive phase ends with homeostatic upregulation, potentially restarting the cycle over again. Now we shall discuss about the types of bipolar disorder. There are 4 basic types of bipolar disorder. Bipolar I disorder. This is defined by manic or mixed episodes that last at least 7 days. At least one manic episode is necessary to make the diagnosis. Depressive episodes are common in bipolar disorder 1. In this type, the manic symptoms are so severe that the person needs immediate hospital care. Usually, depressive episodes occur as well, typically lasting at least 2 weeks, but these episodes are unnecessary for the diagnosis. Second is bipolar II disorder. This is defined by a pattern of depressive episodes and hypomanic episodes, but no full-blown manic or mixed episodes. Hypomanic episodes do not go to the full extremes of mania, and this can make bipolar II more difficult to diagnose, as the hypomanic episodes may simply appear as a period of successful high productivity and are reported less frequently. Next is cyclothymic disorder or cyclothymia. This is a mild form of bipolar disorder. A history of hypomanic episodes with periods of depression that do not meet criteria for major depressive episodes comes under this category. People with cyclothymia have episodes of hypomania as well as mild depression for at least 2 years. Next is bipolar disorder not otherwise specified, also known as BPNOS. This is a catch-all category, diagnosed when the disorder does not fall within a specific subtype. However, the symptoms are clearly out of the person's normal range of behavior. Next is rapid cycling. A severe form of the disorder is called rapid cycling bipolar disorder. Rapid cycling, however, is a coarse specifier that may be applied to any of the above subtypes. Rapid cycling occurs when a person has 4 or more episodes of major depression, mania, hypomania, or mixed states, all within a year. Rapid cycling seems to be more common in people who have their first bipolar episode at a younger age. One study found that rapid cycling affects more women than men. Next is effects of bipolar disorder. When the signs and symptoms of bipolar disorder are ignored or improperly treated, the effects can be devastating, both to the individual with the disorder and those around him or her. Some of the possible effects of bipolar disorder are relationship problems. Relationships suffer because people with bipolar disorder often seem to be unpredictable. People surrounding such persons often become incapable to cope up with such mood swings. Second is disruption to normal daily activities. A person in the extreme depressive phase of bipolar disorder often gets encountered with delusions, hallucinations, and disorganized thoughts, typically preventing him from doing normal things like bathing, eating, etc. Alcohol and drug abuse. Substance abuse is very common among people with bipolar disorder. Some people with bipolar disorder may try to treat their symptoms with alcohol or drugs. However, substance abuse may trigger or prolong bipolar symptoms. Next is increased suicide risk. People with bipolar disorder have a high risk of attempting suicide. People suffering with this disorder are especially likely to commit suicide during periods of depression. Now we shall study diagnosis of bipolar disorder. Bipolar disorder often goes unrecognized and is commonly diagnosed during adolescence or early adulthood. A diagnosis of bipolar disorder is made based on a full psychiatric evaluation, medical history, physical exam coupled with the laboratory tests. Psychiatric evaluation. The psychiatrist will ask a series of questions to the patient about himself and his loved ones, symptoms, psychiatric history, and family history of mental health problems. Medical history and exam. The psychiatrist will ask the patient about personal and family health history. He or she will also perform a complete physical examination to check for mental issues that could be causing or contributing to the problem. Next is laboratory tests. While there are no laboratory tests that can diagnose bipolar disorder, simple blood and urine tests can rule out other medical causes of symptoms. The doctor may also order brain imaging studies such as MRI or CT scan in order to look for brain abnormalities associated with bipolar disorder. Several rating scales for the screening and evaluation of bipolar disorder exist, such as the Bipolar Spectrum Diagnostic Scale. However, the use of evaluation scales cannot substitute a full clinical interview, but they serve to systematize the recollection of symptoms. Bipolar disorder is a mental illness characterized by periods of elevated mood followed by the periods of depression. The term manic depressive reaction appeared in the first American Psychiatric Association diagnostic manual in 1952, influenced by the legacy of Adolf Meyer. People with bipolar disorder experience unusually intense emotional states that occur in distinct periods called mood episodes. The causes of bipolar disorder are not fully known. However, a combination of genetic and environmental factors play a role in the development of this disorder. Bipolar disorder can broadly be classified into 5 different subtypes. That is, bipolar 1 disorder, bipolar 2 disorder, cyclothymic disorder, and bipolar disorder not otherwise specified. When the signs and symptoms of bipolar disorder are ignored or improperly treated, the effects can be devastating both to the individual with the disorder and those around him or her. A diagnosis of bipolar disorder is made based on a full psychiatric evaluation, medical history, physical exam coupled with the laboratory tests.